Hello and welcome to Max Tea. I'm Teddy Draper, a sports broadcaster in the UK. Unfortunately, Dr. Katie Draper can't be with us today, but the protagonist of the piece, Dr. Max Draper, the man who's the testosterone expert on the podcast after testicular cancer and his subsequent recovery, which we've documented in earlier episodes. And here he is, my brother, Max. How you doing today? You feeling well?
Morning.
About to go to Ibiza, aren't you?
Yeah, not long. Tomorrow, travel out in the morning. So
yeah,
sun cream's ready.
Yeah, well, the vitamin D and testosterone connection can be definitely fortified, although you'll get sunburn in 35 seconds being out there on the island. Let's talk on this episode. We wanted to talk about the prevalence of low testosterone for people who are either worried about themselves or loved ones, because I think it was quite shocking, wasn't it? Particularly some of the statistics around young men. Now, you, as people can follow your story, suffered an acute incident, testicular cancer, which led to physical and psychological ill health that you've then subsequently traced back to low testosterone due to having a testicle removed. But in common, in general, how big an issue is this? What are the big stats that hit you around the face in the morning?
Yeah, I mean, there's so many statistics out there on it, and it can often be difficult because ultimately it depends how you define testosterone deficiency as well. And different people in the area, so especially endocrine, the Endocrine Society, for example, their levels where they would define you as having a deficiency might be lower than what you'd actually consider as a practitioner TRT doctor. They might suggest that the levels that is a deficiency is lower than what I would consider to be a problem. So the statistics are quite hard to actually face up to. So, depending on who you listen to or what papers you read, the deficiency might be 2% of the population, or it might be 10 to 40% of the population. And I think it's very hard to define where would you consider it to be a deficiency. And that's where individuality comes into play as well. But certainly on a population basis, almost all of the research would suggest that we are seeing a steady decline in testosterone for at least the last 30 years.
Well, you say steady, and I think what was interesting on the Max Your Tea Instagram account, which people can look up, you put some really good infographics up there. And one that struck me was the one an average 22-year-old man today has the level of testosterone of a 67-year-old man in the year 2000. That's 23 years ago. So that's a pretty huge decline, because I'm presuming that on average, a 22-year-old man should have a lot more testosterone than a 67-year-old man. How much should they have more percentage-wise?
Well, if you look at it in the terms of how much does it decline over with age, you usually would expect to see a peak between maybe your late teens and your maybe 30, something like that. And there'll be individual variation there. But if you imagine there's a steady decline, maybe 1% a year, some would say 2% a year. It really depends on your lifestyle, etc. So if we see a steady decline with age, the 22-year-old should basically be at his peak, roughly speaking. So if you take a 22-year-old and you say, oh, they've got the same levels of someone a decade ago or 2 decades ago who was in their 60s, that implies a really significant drop. So that might be, let's say, 30, 40% lower than what it should have been in the past, or it would be in the past. And the problem that people need to get to grips with is this idea that our physiology hasn't changed in the last 20, 30 years. So if we are all having lower testosterone levels, our bodies aren't adapted to that. And you could say our lifestyles have changed, which have had an impact.
And presumably the methodology of testing testosterone levels is consistent from 2000 to 2023. So there's no big sort of gulf in science and in that time.
Yeah, I mean, from lab to lab, they might use a different assay or they might test slightly differently. But ultimately, you can certainly rely on it to be a rough guideline in terms of, 20 years ago, 30 years ago, there's been a steady decline, which keeps coming up in the literature. There's been several studies on it, which demonstrates, you could look at, say, one study went from 1999 to 2016, and the drop in testosterone was over 25%. Well, so that's quite a significant change. And it's not completely explained either by the fact that people are getting more overweight. So it's not just BMI, which I hear quite a lot. A lot of people say, oh yeah, testosterone is declining. That's just because men are fatter. And that's a bit of an unfair leverage to make.
Because BMI isn't proportionally increasing at the same rate that testosterone is decreasing. Is that what your assertion would be?
Well, what I would look at is the fact that when they try and remove the confounding factors like BMI, you still see a decline in testosterone levels. So they try and remove for the adjustments based in BMI.
And it is the biggest concern around young men. Another stat that you had on the Instagram account, 20% of adolescent and young males have testosterone deficiency.
Yeah, I think the problem will be is if you imagine the role of testosterone in your body and the way that it affects your psychology as well as your physiology, a lot of these young men are never getting that sort of, and this is what a guy called Dave Lee would talk about. He's an Australian men's health practitioner, I would describe him as, and he's really into sort of TRT, and he's into psychology and, you know, mental and physical well-being. And what he described as, and I thought it was really interesting, was if these young men are never getting that boost in testosterone, their psychology can be affected. You know, they're more apathetic. They're less likely to be driven. They're less likely to make healthy lifestyle choices, be confident, because there's all of these processes, not just physically, but mentally, that are related to that surge in testosterone that you get during your teenage years into your 20s, where you almost set up psychological aspects of your personality, which if you're not getting that, or if you're getting, you know, 25% less, then what impact is that having on your long-term?
But you create a psychological pattern for motivation and achievement, and a momentum, I suppose, that you hope carries you through your main adult years.
Yeah, 100%. I mean, that's the problem, is that these aren't getting the surge, so they're not getting those confidence spikes that, you know, good levels of androgens in your blood. So androgens just means, you know, male sex hormones essentially. So you're not getting those surges that you would normally expect to see. And how much does that play a role in the fact that, you know, even societal changes, like less men are going to university, less men are, you know, more men are unhappy, more men are suffering with mental health problems. How much is that underscored by the fact that hormonally we're not as good as we were 20, 30, 40 years ago?
How strong is the connection between testosterone deficiency and mental health in that regard? And how clear-cut is the increase in mental ill health in men, and how much is that clouded by perhaps a greater awareness and willingness for the issue to be discussed? There's a lot of things to sort of pass apart, isn't there, when you look at mental health?
Yeah. I think that's the problem, is that there's so many confounding factors, isn't there? You know, our lifestyle have changed so dramatically over a very short period in terms of our evolution. We're not adjusted to the change in lifestyle we've got. We're less active, so that can impact your mental health. I would suggest it's nigh on impossible to tease out, but what you do know is that, you know, symptoms of low testosterone include anxiety, apathy, depression, poor sleep, reduced stress tolerance. So if we then look at the graph of mental health issues among men, you know,
more
going
susceptible.
up. Yeah, exactly. Potentially you're more susceptible if you don't have good hormone levels. So that's my sort of message, really.
So we said 20% of adolescent and young males have a testosterone deficiency. You said there's not necessarily a chord over what deficiency is. How do you define deficiency? Is there a rough consensus on what that would be in terms of this UK scale, which is roughly 8 to 30, is it, in terms of digits?
Yeah, rough. Yeah, and that varies from area. So, for example, Liverpool's reference range, the 8 is far lower, and that's influenced by the fact that I can't remember the exact statistic, but there's a lot of obesity in Liverpool. I'm not having a go at Liverpudlians, but it's genuinely, you see a trend where if there's more obesity, you tend to have lower testosterone levels. And the lab values are just adjusted based on the average person in the area.
Oh, so, right. So there's no actual absolute standard measurement of testosterone.
Well, not across different areas in the country. Yeah. So I think it was Bristol or Brighton. Their lower end is 6 point something. So again, they've dropped their average levels down, or their normal range. And the problem is the lab is not doing it out of any malice. What they're doing is they're just taking what is average in the area, and then they make adjustments by, like, I think it's 2 standard deviations either way. And then they say, this is the normal range. The problem is, if nationally your average person has a lower level of testosterone, maybe that's 25% lower, maybe that's 30, 40%, depending on what study you read, then the lab ranges are just going to go down and down and down.
Yeah. So the absolute level is going down and down and down in men's bodies effectively. And it's surprising. It's, not to be disrespectful, it's surprising with Liverpool because the reputation is certainly as a sports journalist, as a fighting city, a lot of boxers, big football place as well. And certainly kind of stereotype of being quite aggressive people, which you associate with testosterone, which may be wrong or right. So that's very interesting. In terms of what do you look at then in terms of, do you have an absolute standard because you're working as a testosterone consultant now? Would you look at that 8 to 30 and where would your alarm bells go off? And I suppose how relative is that to the age of the person who's presenting symptoms to you?
I think sometimes you say that men at a younger age should have high levels of testosterone, but then not necessarily, you don't use it to judge the result. I wouldn't suggest that if you're older, then you come back with a level of, say, 9. It doesn't mean that you might not have a testosterone deficiency because you're old, you don't need as much. So I don't have an absolute number. If you look at the British Society of Sexual Medicine, they tend to look at a total of 12 and below being potentially a testosterone deficiency. So that gives you a rough idea. And they use free testosterone values as well, which are harder to explain because it's like 0.225 and it gets a bit complicated. So if you go by the rough total, which doesn't always tell the whole picture, but somewhere around that level of 12, but it is so individual that you have to really try and base it on, right, say you've got a level of 14, but you have several symptoms of low testosterone. Irrespective of your age, does it mean that you might benefit from an elevation in your testosterone levels? Well, I would argue yes. Especially with the fact that unless you're worried about your fertility, which you can kind of look at more specifically, there are different treatment options there. Unless you're worried about fertility, well, TRT is safe.
Would you define the word deficiency as a medical problem effectively? This is a need to, is that how you interpret the word deficiency? It's not just like it's low in the medical world, that in any context, the word deficiency suggests there needs to be something to remedy it.
Yeah, you've got to go by, you don't have enough testosterone for you. So it's kind of like the word deficiency implies to me is that from your symptoms and from your blood results, you're implying to me that the level in your blood is insufficient for you to function properly. And
that's why, I suppose, in an ideal world, we look at hormonal health, and probably the same for women as well, that you'd want a body of testing over time, wouldn't you, to ascertain the individual nuance of some, which we can't do. But if you had a 22-year-old all the way up to 67, you could chart where that person was in a natural stage of decline.
Yeah, I suppose in an ideal world, you would kind of have an idea at 20, what were you like at 20? What were you like at 30? What were you like at 40? But then
in the same way you test heart rate and blood pressure and things like that, the doctor, it could be a standardized test maybe.
Yeah, I mean, so what Dr. Morgenthaler, who's I think he's a doctor in Harvard, I believe it is. He's big into his testosterone and statistics and looking at the link with testosterone and other health conditions. And what he says is that your testosterone level is often a very good health marker for a guy. So, it can be linked to other conditions, or it can improve it can give a highlight of what is your overall risk of developing, say heart disease, diabetes, dementia. There's lots of conditions that are linked with low testosterone. So almost as a metabolic marker, you could use it to say, right, well, here you're at now, 10 years time, you repeat it. How are you feeling? Which is the mainstay of all sort of testosterone analysis. And then you could give a rough idea. Well, 10 years ago, you were at this level.
And how you're feeling, presumably there has to be a sort of psychotherapy element to that, where you take in the contextual variables of someone's life as well, because obviously some of these symptoms could be overlapped with periods of high stress or bereavement, or as you get older, life throws more things at you as well. So I suppose you have to pass those apart from the physiological.
Yeah, I think that's really interesting area, because again, when you go into, for example, depression, you always have to try and work out whether it's reactive. So, say if someone passes away, well, you're going to feel down, you're going to feel depressed. Whereas is that an innate, inbuilt depressive illness? You'd argue, well, no, because you've got things to make you feel sad. So it's a very different, and so the treatment would be different. What I would argue with testosterone, though, is that if it is not ideal, if it is low, then you're going to react more poorly to stresses in your life. So it can have a role in terms of
exacerbating.
Yeah, exactly. I mean, look at me when I had low testosterone, I couldn't deal with stress. I couldn't, I wasn't getting good sleep. So it's kind of, it all is a bit of a vicious cycle. And so it can be a bit of a tumble down a hill. And that's where you talk about TRT being that sort of, right, we're going to stop the tumble and we're going to start to allow you to climb back up the hill to feel better. So with lifestyle changes, you kind of make a change to someone's life completely.
For young people, we mentioned that 20% of adolescent are young males. That we mentioned the 22-year-old man comparison to the 67-year-old, and you alluded to the fertility issue as well, that people of that age obviously may have aspirations or may not even thought about whether they want kids or not. How relatively low can the deficiency be remedied by lifestyle factors then, by sleep, by exercise? Because presumably it's a big call for a young guy who hasn't had children yet to go on testosterone therapy.
Yeah, and the sad thing is, and I think most TRT doctors, if you watch them online or speak to them, is that they'll say that we're seeing younger and younger people. So it's kind of like, so we have a cohort of patients who have just, got to their 50s, got to their 60s, and then often what will happen is their testicles aren't working as well as they were, so they'll have a testosterone deficiency, and you can see that in their blood work. But what we're tending to see a lot of now is men in their late 20s, early 30s presenting with low testosterone levels in their blood. And it's essentially what we call secondary. So what it is the testicles just don't have the stimulation from up here to elevate those levels of hormones. And there's various factors there. But yeah, the problem is how much can you change in terms of lifestyle versus needing to consider.
Well, if you're 11 and you view 12 as the cutoff for deficiency, could you get 11 to 15 via lifestyle? What's your take on it? Obviously, it's individual nuance. If you had someone who was obese, who was staying up at night playing video games, was eating a terrible diet, was exposing themselves to stress in a relationship, whatever it might be, could you get that individual hypothetically into a safe zone without therapy? Without testosterone added exogenous?
Yeah, I think it's very individually based. So you have to kind of work out why you're deficient. Is it the testicles are failing, or is it because if your testicles are failing, it's hard to suggest that you could reverse it. A lot of the young men don't have testicular failure, though. What they have is a lack of signaling coming from the brain down to the testicles, and exactly what you said. So that's obesity, activity levels, stress, poor sleep. So how much can you improve it with lifestyle changes? Well, I would say it depends on, for example, are you obese? Are you inactive? Are you getting enough sleep, etc.? So that's what I do when I speak to guys, is it's kind of say, you do a very holistic approach. So you say, what's your job? What's your job like? How much sleep are you getting? Are you active? What's your BMI like? Although BMI is,
have you got babies at home? Yeah, stuff like that.
Yeah, exactly. I mean, there is actually links with. We know that when men have children, their testosterone naturally declines a little bit, and there's various factors in that. Stress, sleep, but also if you remove those factors, i.e., if you remove the fact that you're getting less sleep often, you're more stressed often, they still natural response is to drop your testosterone a little bit. It's
is that connected to oxytocin as well, potentially?
Well, potentially there's a lot of hormonal changes. It's almost like you imagine that instinctually maybe it's something that's we've developed over time in order for men to be a little bit lower in the T levels, so they stick around. Maybe, I don't know. You'd have to sort of look.
It's a little bit more cheery when you've got young babies around, less edgy, maybe.
Or less driven to get out there and go about, I guess. More likely to stick around, I think, is the theory. But yeah, I think that's a really interesting question. If a guy comes in and they've got fairly low levels, but they're not doing all the right lifestyle stuff, I think you would be keen to consider them changing a lot of lifestyle stuff and then repeating the levels, because it's impossible to know how much lifestyle will be able to be corrected. The other thing is, obviously, if you've got low testosterone levels, do you feel able to make the lifestyle changes? So again, that's where you have to consider
motivation.
Yeah, exactly. Motivation. Vicious cycle with obesity, isn't there? Because if low T causes you to gain more fat and lose more muscle, and you've got low testosterone, it's kind of like you don't have the metabolic systems going on to correct the problem.
Yeah. Although on the flip side, when you're at the ground zero regarding exercise, it's that first early stages of exercise are the most pronounced spikes in improvement in physiology, aren't they? So there's an upside, there's a silver lining to that situation as well.
Yeah, Dr. Peter Attia talks about that. It's kind of like he's all about his longevity and health span. He says the biggest change in terms of positives is going from 0 to like 1 to 2 hours a week of exercise. And I would suggest that's probably the same hormonally, metabolically in the body. You know, you're going to go from doing 0 to maybe 2 hours of exercise a week is going to make a big shift. You'd have to really look at that when assessing a guy who has low testosterone. Maybe it's not severe, but you'd have to say, you know, are you actually going to benefit from, if you can, make those lifestyle changes and then repeat it down the line and see, well, how much of a jump has that made? The issue can be is low T can affect your ability to make the changes.
And a person who presents to you at 21 who won't know probably yet what they want to do with their life, whether they want children. You know, a lot of people when they're younger who said they didn't want children now have children, friends and acquaintances of mine. Is it something that they should be aware that they can still have therapy and increase their testosterone through therapy, but it very, very much changes the dynamic of you have to have other injections, etc., to keep your hormonal health and keep you fertile potentially? Yeah.
So what we used to use a lot of is something called Clomid, which is a tablet. And what that essentially does is if your testicles are able to respond to it, if your brain are able to respond to it, what happens is you send more signals to your testicles to make more testosterone.
Is this connected to clomiphene, which has been in the boxing circles?
Yep, it's exactly the same medication. So you imagine that what they're doing is they're abusing, taking
allegedly.
Clomid.
Yeah,
allegedly they're taking it in order to boost their own hormonal production. So you can use that. The issue with that medication is in terms of symptom benefit from it, you don't tend to see the same degree of symptom resolution as you do with good testosterone, basically because what it does is it's a fake estrogen in essence. And what it does is it affects the estrogen receptors to trick your brain into creating more testosterone from your balls. Now, the issue with that is that estrogen is a feel-good hormone. So if you're affecting the receptors, you can end up not getting the full benefit from the raise in testosterone that you usually do see it work in that sense, but it doesn't necessarily get the symptom results.
What about young men who've had testicular cancer? Because it is a young man's disease, isn't it? I think people deem it that.
Yeah.
What are the upshots? I don't know how common it is, like yourself, to have a testicle removed as an upshot of testicular cancer, and how common is testosterone deficiency following testicular cancer, whether you have a testicle removed or not. Is it sort of 95% of people have testicle removed? I don't know what the average is there.
So yeah, if you have testicular cancer, you're very likely to get a testicle removed, plus or minus chemo, really. So I would suggest that you are a much higher chance of developing testosterone deficiency if you have one testicle. Almost as if, if someone donates a kidney or loses a kidney, then what happens is they tend to get regularly monitored for their kidney function, purely because we know that one kidney is more likely to start struggling than if you had two. So it's a very similar pattern with a testicle. I don't know the exact statistics in terms of how likely are you with one testicle to develop testosterone deficiency, but you'd imagine it's significant.
Yeah, because you put extra. It's like having one arm, and the fatigue's going to be higher if you're trying to carry things.
Yeah, exactly. And even particularly, obviously, if you've been through chemotherapy, which I fortunately didn't have to have, but that's a strain on the body. That's a strain on your cells in the body, obviously, because what it's designed to do is kill rapidly dividing cells. That's what all chemotherapy does. But you inevitably affect your healthy cells as well. So that potentially, again, will compound the risk to your testicle function. And different chemos are different chemotherapies have different effects on your testicles. Some are more toxic, some are less toxic, from what I gather.
And you had meningitis around the same time, didn't you, as testicular cancer? Was that viral meningitis? What's the link there between? Is that a common link between meningitis and low T?
I wouldn't suggest it was common, but I would suggest it might be a risk factor based on the fact that anything, any form of brain trauma can impact the signaling system from your brain down to your testicles. So potentially, people who have been blown up in wars and things like that, so army officers, they can have really hormonal issues because that brain trauma affects the homeostasis sort of mechanisms. Yeah.
I suppose the elephant in the room, and we should wrap up the story with here discussing the theories on why, not on an individual level, like having testicular cancer, although that could be connected to a general trend if you look at cancer rates, I suppose, but why people are getting lower testosterone on average, why men are. We've mentioned the statistics around young men versus older men, and that big difference between the year 2000 and 2023. What are the hypotheses of why men are having lower testosterone? What's the ones that you sort of see? And clearly there's not a definitive answer just yet, but what are the main theories?
Yeah, so I like to look at it in two terms, really. It's kind of like the individual person and what are they exposed to. So, for example, we know that obesity is everywhere now. I think it's something like 70% of adult men in the UK are either overweight or obese. So if you imagine, again, depending on which studies you look at, we know that obesity or being overweight reduces your testosterone level. If more men are overweight, then the average testosterone in the society is going to go down. It depends, again, what study you look at, but each BMI that you go up in points, so 1 point reduces your testosterone level by maybe 2% or more. So again, that natural testosterone booster, I did a video on this on Instagram. What are the best natural testosterone boosters? Well, it's being lean and being active, because the other part of it is
not too lean, presumably, because there's always a curve with those things, isn't there?
Yeah, exactly. So if you're too lean, it's kind of like a form of stress on your body. Our testosterone doesn't like stress. So, somewhere individual variations, somewhere maybe between 12 and 16, 18%. But again,
body fat.
Yeah. I mean, everybody's different, isn't it? So I might feel awful if I'm below 12% body fat, whereas someone else might feel great at 10%. That's very individual. But what we do know is that being overweight, being obese can really hamper your testosterone level. So that would be number one, I would suggest, in terms of the general decline. The other one would be that there's a link with cardiovascular fitness. So we know that fitter guys tend to, or at least in one study, tend to have better levels of testosterone as they age. So one is BMI, one is cardiovascular fitness. More of a subset would be things like type 2 diabetes is rife, So again, you look at the fact that type 2 diabetes and insulin resistance affects your T levels. And then there's things like, people are on more medication, people are more medicated, more people are on antidepressants. Antidepressants, at least a few of them can impact your testosterone levels. Some blood pressure tablets can reduce your testosterone levels. So lots, statins. There's lots of medication out there, and a lot of people are on what we call polypharmacy, which is when they're not on just one tablet, they're on 5 or 6. I think I saw a stat about the US where they said that the average 40-year-old and above I think it was the average 40-year-old in the USA now is on 4 medications, I think. So
it's massive.
It's crazy. But I would suggest the other thing to consider, which is more scary because it's not what things that you can necessarily change, is the exposure to endocrine disrupting chemicals. Because I'll tell the listeners that the vast majority of the guys that I see who have a deficiency in testosterone are not overweight. They're not inactive. It's not lifestyle. For some reason or another, they've had a decline in their hormone levels, and it's been significant.
So we're talking water pollutants people are drinking. Is that the main one? Hormones in the water? That's a theory you hear bandied around?
I would suggest it was more like things that your food is being wrapped in. So phthalates, we call them like endocrine disrupting chemicals, and they're basically everywhere. So, the levels of plastic that we use in society has gone up like 5-fold in the last 30 years, I believe. So what's your food wrapped in? Often plastic cellophane. What are you washing with? Often, there's lots of different chemicals in your body wash, your shampoo, your soaps, hand washes.
And they're in plastic containers, aren't they, usually?
Yeah, exactly. So again, this is not sort of like a conspiracy theory. There's books written on it. There's studies on it.
There's a woman called Dr. Shauna. I can't remember her name, but she's in her 80s. She talks about the fertility, sperm rates dropping. So I don't know whether it's analogous to testosterone levels, where there's a connection there. And she also talks about the length of the taint, which everyone has a good giggle about, but it's between the bottom of the bottom of the testicular sac and the bum, the anus, the gooch, whatever you might call it. She says that's shrunk in recent years, along with fertility. So do you sense a connection there with testosterone, with those issues that she's highlighted?
Yeah, hugely. I heard a TRT practitioner the other day say that testicular size at birth has decreased as well. So I don't know how they measure that, but presumably they've got a system in place where they can compare now to 20 years ago. So yeah, these endocrine disrupting chemicals. So what they often do is they mimic estrogen, and they do a bad job of it. So what they do is they kind of trick us into making less testosterone. They also reduce potentially the number of receptors for testosterone in our body, and they affect how well the testosterone can attach to the receptor in the body. So it's kind of like a triple assault on our hormones, particularly as men, but it affects women as well. If you look at sort of like young girls starting puberty earlier and earlier, there's a suspicion there that that's due to fake estrogens in the environment stimulating earlier puberty.
And not better nutrition, because wasn't that a theory that it was better nutrition before that was stimulating that, or more abundance of calories?
Yeah, the problem is that who do you listen to and who do you trust? It's very much the same with dietary advice, isn't it? So so extreme.
But like we said, there's nothing conclusive in terms of this is the issue and this is the type of plastic and this is what you should avoid, or this is what's the water you should avoid. But what are the, you can get fatalistic about it, but presumably there are measures you can take even within that. Obviously, lifestyle issues you can address. You can try and exercise, even if it's walking around the block, because that cardiovascular health with testosterone's, I think, a big one, because that can be improved if you're very cardiovascularly unfit by walking versus the psychological motivation you need to go and lift weights in a gym, which is a big challenge for a lot of people, which will often associate resistance training with testosterone, don't we? But what are the things? I suppose we can filter our water. Can we things like that? Can we gravitate to open vegetables in the supermarket that aren't wrapped in plastic? Can we grow our own vegetables? I suppose there's little bits that we can cheat the system as much as we can to get the percentage of the pollutants down, even if we can't completely get away from them in a Western society.
Yeah, I think there are little practical aspects you can make, and the problem is it's very difficult to get a gauge of how much is each individual going to make it. Each individual change, I should say, going to make a difference. But if you imagine that potentially this change increases it by 1%, this change increases it by 1%, this change, so you're just gradually making positive effects. So exercise and losing weight obviously would be huge. The evidence is that if you are overweight and you have a lower level and you're able to reverse the weight gain, well, that can certainly improve your hormone levels. Again, it's like we said, are you able to make those changes with low T? But yeah, certainly things that you can look at as practical aspects is looking what is in your daily self-care ingredients, so what is in your soaps, what is in your body washes, what is in your shampoo. Can you eat organic? So organic's better. It's not perfect because still they're able to use certain things on your crops.
I heard a statistic that roughly 30% of the chemicals get through organic compared to what's considered standard now.
Yeah, I think it's a lower level of allowance, basically. So you're not allowed to use certain chemicals or insecticides, but you're allowed to use some things, is from what I gather. So
it's also in the system, isn't it? Water's fluid by definition, so it gets around. So it's not,
Yeah, so filtering your tap water is quite an easy one, because there's certain, sort of like you can get activated charcoal. So you fill your jug of water and then you stick an activated charcoal in it, give it an hour or two, and it's supposed to have made a positive change. So there are lots of practical aspects you can look at. Again, it's almost like a lot of this will be a preventative measure. Yeah, so it's kind of like catching it early.
I think we should do a conversation in the near future about that, obviously after your holiday, about the actual what people can do to preserve it, maybe as they come into adolescence and things as a key component. Max, great to talk. Are you going to be posting in Ibiza on your Max Your Tea Instagram? What's the plan?
Yeah, I hope to. Yeah, I've done a few little recorded snippets already. I tend to do them in little bundles because then Katie sits there and does it. I don't know how to use social media at all. I'm completely IT illiterate. Yeah.
You can hide.
She's got quite nifty at it now. You
go for a jog on the beach then while you're on holiday, and she can do that with the kids bouncing around her while she tries to do it. Max, great to catch up. We'll speak soon again, my bro.
Thanks, Teddy. Take care.